Good afternoon, everyone. This is Tony Kubay with the Justice for Immigrants campaign. We hope all of you are well and doing what's necessary to stay healthy. These are uncertain times we're in, but fortunately we are also in the season of Easter. So with our Easter blessings to all of you, thank you for joining us for this webinar today to hear more about COVID-19 and the impact of U.S. government relief on migrants and families. There are some great presenters on the webinar today, and in just a moment I'm going to turn it over to them for their expertise. I do want to go over a few housekeeping items first of all. Let's see here. We have almost 100 people on this webinar now. It's 2:01 p.m. On the East Coast, and so yeah, we're at 96 people at the top of the hour. So basically, at the start of the webinar. So when we have webinars like this with this many participants, we have to mute the telephone lines so that we can cut down on the background noise. Otherwise, it gets too unruly. So I know you'll have some questions. At the bottom right-hand corner of your computer screen is a chat box, and that's where you can ask your questions. So if you have any questions for the presenters, if you have any comments, if you wanted to share any other information, I invite you to type those into the chat box, and we will get to as many questions as possible. Okay, we'll stop in between presentations. We'll also have time at the end to answer questions that are typed into the chat box. Let's see here. A few other items. This recording, I know that some folks have expressed interest in getting the recording for after the webinar. So this recording will be archived in the justiceforimmigrants.org webinar page. After the webinar, I'll send you all the link so that you can access it, as well as a link will be provided in the next JFI Week in Review, which is going to go out a week from today, next Friday, May the 1st. Okay, let's see. That should be it for my my introductory comments. Let's see here. Presenting today will be Laura Peralta-Schulte with Network, followed by Christopher Ross at Catholic Charities USA. Clay Odell, actually, that should be flipped. I'm sorry. Clay Odell will be presenting second. He is our policy expert with Catholic Health Association, and batting cleanup will be Ashley Feasley, the Director of Policy at USCCB and Migration and Refugee Services. So this is a timely webinar, and I hope that you folks will gather a lot of information and ask a lot of questions. As I mentioned at the very beginning, we are in uncertain times, certainly unprecedented times. There have already been more than 30,000 deaths in the United States as a result of COVID-19. We are seeing millions of new people joining the unemployment numbers, joining the unemployment rolls over the last few days and the last couple of weeks. We have undone many of the gains as far as employment is concerned since the Great Recession of 2008. There have been a number of initiatives and legislation passed through Congress that seeks to address the financial hardships, the health concerns that the people in the United States are undergoing right now. And I'm going to go ahead. I mean, those are my introductory comments. I'm going to go ahead then and turn it over to Laura with Network to review kind of what's been going on, what's happening, and where we are with the state of play. Okay, so Laura, I'm going to go ahead and turn it over to you. I'm going to flip it to your first slide. There you go, Laura.
That sounds great. Thank you so much, Tony, and thanks to everybody for coming on the webinar today. I know we all appreciate how active our community has been to really put these issues at the forefront. And so it's really our pleasure to get you up to speed and to talk about next steps forward. So my role today is to really talk about what has happened to date. So you, having read the paper undoubtedly, know that our Congress has passed a number of packages, and there is already discussion about a next package. So what I'm going to do is just kind of walk you through what has been in the various packages, and then my colleagues from CHA and Catholic Charities and Ashley from JFI are going to walk you through our asks, particularly for the next one. The one piece I want to just lay out as we begin is that it is important to understand that low-income immigrants have really historically been excluded from various programs. It's a structural barrier. And in particular, as Tony walks through what is happening right now, we are seeing immigrants play a very vital role in terms of confronting the pandemic, from the healthcare sector to really harvesting our food and everything in between. It's important to know, and again, my colleagues will walk through the specifics, that there has been some very limited relief to date for immigrants and their families. But the big picture is that most of the federal response has left immigrant families out of the packages. So Tony, if you can go to the next slide, and we'll talk through package one. So you will recall perhaps that in the first package, the first package was really the beginning of congressional work, and much of it was aimed at simply, the fastest package out they could deal with the emergency. We had a second package called the Families First Coronavirus Response Act. We had a third package, again called the CARES Act, and yesterday, and the President frankly just signed it today, a 3.5 package. So let's look at those. Tony, if you can go to the next slide. So the very first package, again, this is a package that started in the House. The idea was to get as much money as quickly as possible out to state and local governments, as well as tribes, to boost R&D in terms of trying to find a solution, a vaccine for the pandemic. Money for healthcare preparedness, given the fact that COVID is a healthcare crisis. Some assistance in terms of flexibility, telehealth for Medicare, and then some assistance for families as well as small business. The political dynamics around this bill, again, it started in the House, moved to the Senate, and went very quickly, but it was our immediate response. Go to the second slide, please, Tony. That followed on, again, a very short time later with a second package, again focused on testing and healthcare. And again, Clay will talk you through the entirety of the package as it relates to healthcare, but free testing for corona virus with those with private insurance and various federal programs, strengthening food assistance for families and seniors, including support for food banks, safeguards for Medicaid benefits to expand coverage. We had enhanced unemployment aid for laid off and furloughed workers, and importantly, we had the establishment of paid leave for most workers should they get sick or need care to take care of their families to prevent really spreading COVID from moving forward. Again, this was a package that started in the House. The politics got increasingly difficult. I think it is fair to say that there was push by Senate leadership to keep it a narrow package. But given the dynamic, then it went from the House over to the Senate, and the Democrats in the House had a fair bit of leverage. You had a pretty robust program. We'll go to the next slide. The CARES Act. Now, the dynamic on the CARES Act was a little bit different. This was a package that started on the Senate side. And initially, this package was very narrowly tailored towards supports for the business community. But again, as these bills have had to go through Congress, it was a negotiation between the House under Republican leadership, the House under Democratic leadership, the Senate under Republican leadership, and the White House. So, but at the end of the day, we had a more robust package than simply business assistance. There was in the third package money for hospitals, healthcare providers, and equipment. There was particular funds in there for community health centers that really addressed the rural situation. You had unemployment insurance, which is 4 months for workers who normally don't receive unemployment, which was a very, very strong piece of legislation to expand our unemployment system. Importantly, we had direct payments to families. You had a $1,200 cash payment, $2,400 for joint filers, plus $500 per child. The challenge here on this call, and I know that Chris from Catholic Charities is going to talk about this a little bit more in depth, to get the payment, you have to have a Social Security number. So you had millions of mixed status families and 4.1 million kids who do not get that benefit. If you can go to the following slide. Again, this was a robust bill, so we had assistance for homeless. You can imagine that being homeless in the middle of a pandemic can really be a death sentence. And so it was very, very important to get assistance for the homeless population to increase our investment in affordable housing and assistance. And finally, you had included in that package supports for small, medium, and large businesses. So that the businesses could take or get loans to stay afloat. And I think we're all aware of the challenge from an economic standpoint. I would say from a network perspective, one of the things that we really worked hard on was to try to confine the benefit to businesses that really need it, as opposed to what was the case in 2008 bailouts, where a lot of those benefits went to folks who frankly don't need that. Tony, if you can go to the next slide. Finally, there was a passage of a bill just this week. This was the fourth full package, but certainly not the end of the discussion in terms of next packages. This was a package, again, that began on the Senate side. Initially, the plan from the leadership was that it would be a package simply to put or replenish funds for the Paycheck Protection Program, which again is loans to small business. That bill was enhanced through negotiations, particularly with the House, so that it contained, importantly, money for hospitals and nationwide testing, because testing is really the key to get people back to work. And I'm wrapping up now, so Tony, if you go to the end. A question about the next package, my colleagues will talk about. We believe it is very important to have a next package given the real dramatic impacts on people and on the business community. So we know that there is in development, at least on the House side, a package that we are trying to get our objectives put into. And with that, I'm going to leave it to Clay and to Chris and to Ashley to talk a little bit more about what was included in these packages and to lay out our asks as we move forward.
Well, Laura, before we continue, I think this is a question that's in your wheelhouse. Does the CARES Act unemployment insurance include church workers laid off whose employer did not contribute to unemployment?
You know what? I need to thank you for the question. I don't have a response on that. I don't know if our colleagues do, but what I can do, we are part of a very large coalition of folks, and many of them are experts on this issue. I can promise to get that answer back to you, Tony, and so you could share it.
Very good. Thank you, Laura. And Matt Davis in Camden, we'll get that to you. Clay, I'm going to go ahead and have you up to the plate now, and go ahead, Clay, please. Thank you.
Okay. Thank you, Tony. This is Clay Odell with the Catholic Health Association, and I'm going to talk a little bit today about some of the healthcare provisions that have been in some of the COVID relief packages and how that's affecting the immigrant community, and particularly looking forward to how we would like to see something in the future packages that would help them a little bit more. So if we could move to my first slide. And what you see here is just a little overview of the current state of health coverage for lawfully present immigrants. They are qualified to get health insurance through the Affordable Care Act exchanges, eligible for premium tax credits there. When it comes to some other federal benefits, especially Medicaid, which is a very important program in getting treatment for COVID out to people, legally present immigrants are subject to a 5-year waiting period. And that's also true for the CHIP program, although states do have the option to provide Medicaid and children's health insurance program for children and pregnant women without a waiting period, so that depends on the state. Refugees and asylees with qualified status are not subject to that waiting period. Others, such as temporary protected status holders, may or may not be eligible for Medicaid or children's health insurance, again, depending on the state. So this is a very patchwork system in terms of lawfully present immigrants. And as we'll see in the next slide, there are still additional barriers even on top of those. One of the most pressing is the public charge rule, which is being implemented just as a couple of months ago. It can prevent lawfully present immigrants from adjusting their status and getting a green card if they have used federal benefits, including the Medicaid program. So that's especially of concern right now, considering, again, how important Medicaid is in getting treatment out for this pandemic. The administration did say recently that COVID-19 treatment will not count in public charge determinations. And so that's a welcome development. We would still like to go further. We completely oppose this rule. I would note here, because I think it will be important down the road, that CHA certainly was one of the organizations that fought against this rule, as did the other organizations on this call. You know, we worked together on that a lot. And one of the arguments that we made is that this rule would be detrimental to public health, and that in a public health emergency, it would do much more harm than it does in normal times. And the fact that the administration immediately came out and exempted COVID-19 treatment, in my mind, really accepts that argument. It makes the point that this law, that this regulation is not good for public health. It's a terrible thing to have in a public health emergency. And again, I just want to flag that because I think later on, if that rule is still in place and implemented, it will be important for all of us to come back to this moment and say, even the Trump administration admitted that it was a terrible rule to get in the way of COVID-19 treatment. So that might be something that's an important talking point down the road. And just to show you here some of the effects of all these patchwork systems and barriers, 23% of lawfully present immigrants were uninsured in 2018, and that compared with only 9% of U.S. citizens. So all of these different barriers really are keeping even legal immigrants largely out of some of these programs and leading to a much higher rate of being uninsured. And on the next slide, we're going to look at health coverage for undocumented immigrants, and this is really no health coverage for undocumented immigrants. They are not eligible for the exchanges or for premium tax credits, generally not eligible for Medicare, regular Medicaid, or CHIP. They are eligible in circumstances for something that we call emergency Medicaid, which is being present at the, say, the emergency room if somebody is not on Medicaid but may be eligible. The provider can draw on funds to treat that person and then follow up later in terms of eligibility. That's for low income and non-emergency health services at community health centers or safety net hospitals. And if we look at the effect of this sort of shutout, 45% of undocumented immigrants were uninsured in 2018. That's nearly half of that population, so you can see how that affects. And if we'll move on to our next slide, please. We just saw a study that came out of the Migration Policy Institute, and it's quote the reference is down there at the bottom of the slide. I would recommend it to you. But just to point out a few things that are becoming very important during the pandemic. 38% of immigrants are working in industries that are very hard hit by the economic situation right now, including food and accommodation services. And many have incomes below 200% of the federal poverty line, a higher percentage compared to their U.S.-born counterparts. 28% of these workers lack health insurance coverage, twice the rate of U.S.-born workers. And 38% of these immigrant workers have a minor child at home compared to 23% of U.S.-born workers. A very vulnerable population right now in terms of the industries that are being hit by the pandemic and whether or not people have not just insurance but a paycheck. So let's move on to the next slide. And what I've put here is just an example. There are so many examples. We could have a million of them, but just in the last week, we saw examples of how this whole situation is really playing out on the ground in terms of immigrants and immigrant health and the pandemic. We saw outbreaks in South Dakota and Iowa and other places in meat processing facilities where a large number of immigrants are employed, and this has been a great disruption, not just for the people and for the businesses, but also for the food chain. So that's something that really is a major impact on public health and how we all are dealing with the pandemic. In one of those states where that happened, North Dakota, just last week, you saw a 30% increase in COVID-19 cases. Some other states where agriculture and meat processing industries are important and employ a lot of immigrants. COVID-19 cases jumped 22% in Arkansas, 26% in Oklahoma, and look at that number in South Dakota, 260% in 1 week. So this is an area where we're again seeing how this is affecting the pandemic and the public health situation. So next slide. We heard from Laura about the background of some of these relief packages. I will point out a few things here in terms of some of the healthcare funding. The third supplemental that we just few weeks ago, had $30 billion for providers. Other healthcare funds will be coming out of that because it was a total of $100 million. That's supposed to help COVID hotspots. It'll go to Native American healthcare. There's about $10 billion in funding for the uninsured. We're not exactly sure how that's going to be dispersed yet. We're still waiting to see. That interim bill that just passed yesterday, the Paycheck Protection Program Increase Act, provides an additional $75 billion for healthcare providers and $25 billion for I wanted to note here that in the House version of the CARES Act, which is not the one that passed. It was the Senate version that passed, Mara was saying, and going over there. But in that original House version, there was language clarifying that the funds that were being given out for COVID-19 were to be available to all regardless of immigration status. And that's important because that does show that some people in Congress are paying attention to this issue. And so I wanted to flag that in terms of moving forward, hopefully building on some of that support. Because that fourth supplemental CARES 2.0 is expected in May. And as Laura pointed out, we expect that to start in the House. So given what was in the House third supplemental, that's a hopeful sign. And next slide. So what is CHA doing to expand the opportunities to provide healthcare for immigrants during this pandemic? We are supporting legislation called the Coronavirus Immigrant Families Protection Act. That's HR 6437. And that would ensure, again, the availability of all of these funds to treat COVID-19 for all, regardless of immigration status. And then we also this week joined with other healthcare providers, which is an important step too, because this isn't just a Catholic issue, this is Catholic healthcare. It's other healthcare providers that are seeing how important this is. And several of the things in this letter that we sent up to the Hill this week were mirrored in that legislation. So I'll point out three of them. We asked to halt implementation of the harmful public charge rule to go beyond just COVID-19, but to halt it at least temporarily, if not permanently. To include language in the next supplemental ensuring that funds for testing, treatment, and eventually vaccination for COVID-19 are available to all, regardless of immigration status, and continuing to provide additional funding and resources for safety net providers, which is often where immigrants usually seek treatment. CHA will be outlining these and other priorities from our Catholic Health Ministry to Congress next week as they prepare to come back in May and get work on that fourth supplemental. So that will be going out next week again to Congress. And could we have the next? So just to wrap up here, I wanted to emphasize that with our advocacy and some of our messages here, CHA and certainly all of our partners on the phone and all of you out there who work so hard on immigration issues, we argue that in our Catholic organizations from a moral perspective, and that's the good and right thing to do. But it's also important, especially at this time, that we make the point that this is a public health issue as well as a moral issue. And hopefully that will reach some ears that we might normally don't reach. So our message to Congress and the administration continues to be that testing, treatment, and vaccination for COVID-19 must be available to everyone, and that's regardless of immigration status, regardless of income level, regardless of insurance status. That's the only way you stop a pandemic. Everybody's got to be treated, everybody's got to be tested, everybody's got to be vaccinated, full stop. So hopefully you will all join us in taking that message as we go forward looking at additional legislation. And I invite you to go to our website there for more resources on what CHA is doing to address coronavirus. And with that, I'll turn it back to you, Tony.
Thank you, Clay. Great information. I highlighted for myself, in fact, the information you provided about the food chain and via the 260% figure for South Dakota. Very, very good information to have. Clay, we have a question here from Dr. Sue Weischer down in New Orleans, and I think I know the answer, but I wanted to have you answer it. Does the latest bill include testing for undocumented immigrants, and where would they need to go to get that testing?
Do you mean the latest bill in terms of the CARES Act, the third supplemental, or the third?
The third, yes, correct.
Yeah.
Yes,
well,
yes, correct. That's what I'm thinking.
Yeah. What will happen with that money is that it's dispersed to different providers in different places. So depending on those providers, it will depend on how they use those funds. So if money goes to, say, a community health center or a safety net hospital, that money could be used to treat immigrants regardless of status, because that's normally what they would do. So depending on how much, on what kind of funding they get and whether they're reimbursed through that could be used. The clarifying language, though, is important in terms of making sure that all the funds that are dispersed, not just that go to a safety net provider that might see a large immigrant population or a community health center that does, but that the funds that go anywhere and everywhere to all hospitals, non-for-profit, Catholic, et cetera, make sure that all of that could be used without those barriers to immigration status.
Thank you, Clay, for that. Appreciate it very much. I'm going to go ahead now and turn it over to Christopher Ross, our colleague at Catholic Charities USA. Christopher, if you can speak into the phone so folks can hear you clearly, we appreciate it. Go ahead, Christopher.
Okay. I'm going to talk about the relief efforts that we've seen in the past few weeks, first with the IRS and the economic impact payments, and then food and nutrition, both at the federal level and the state and local, as well as the private. So go to the next slide. Okay, so this was in the news last week and a little bit of this week. The IRS economic impact payments, the rebate checks. We were following this. There was a lot of discussion of when they would be released, and they did come out last week through direct deposit. And if you don't have direct deposit, they are still filtering out into the country with paper checks. It's my understanding this week as well. The requirements that went along with these rebate checks: you had to be a U.S. citizen or a resident alien. We, in the immigration community, had to do a little bit of digging in there because resident alien, we often think green cards, lawful permanent residency. This perspective was with tax purposes in mind. So the physical presence test, if you could show that you've been in the United States for the past year, if you pass that test, then you should qualify with a Social Security number. You also can't be a dependent of another taxpayer, and the adjusted gross income limitations also apply. So those are the three criteria. They're available on the IRS website for COVID-19. There was some consideration there for public charge, and this is not going to be considered in the public charge analysis because, again, as I mentioned at the top, they're considering these rebate checks, and therefore the public charge, this is not receiving government assistance. This is money that has been paid into the system as a rebate. So that's actually positive news, given that how much public charge is a factor in benefits and a lot of, honestly, what I'm going to present on. Also, who may be eligible, DACA and TPS, they should be receiving checks here because they've been given Social Security numbers. Mixed status families, that was another issue that came up frequently. Unfortunately, some bad news there. So I'll give a small shout out to the National Immigration Law Center. They had a presentation on this issue with the caveat that this is still developing, but if a tax filer's spouse or child doesn't have a Social Security number, no one in that family would be claiming the credit. And also with the families that we often interact with, if they were using an ITIN number, an individual tax ID number, that does not qualify. And this is not the same as a Social Security number. It's just used to pay your taxes if you don't have a Social Security number. So if you have an ITIN, you would not be eligible for these rebate checks. Next slide. Okay. The other benefits that I wanted to talk about today are all in consideration of with the public charge. Back in February, this regulation did go into effect after a long court battle, and so it does stand to today. Other people can speak about the testing and things like that on how public charge is a factor in even receiving those benefits potentially, but for the food and nutrition aspect, any program that people look to participate in, they need to be cognizant of how it could affect their pursuit of a lawful permanent residency or a green card later on down the road in their immigration case. So I've included on our slide an updated one-pager on the programs that are included in that would be considered in the public charge analysis. If it's not listed on that one-pager, then you should be eligible. Again, talk to your social service providers through Catholic Charities, talk to your immigration attorneys to be sure, but the programs listed there is the ones that cannot be participated in order to avoid public charge. So please use that resource. If they're not listed, they are eligible, and so they can get some relief there. That's the federal level. So as I'm sure many of you are aware, the federal programs, there's not much good news there for immigrants. So people do tend to look for state assistance, and that's the next slide. So the state food and nutrition, again, always consider public charge, but there are different programs that would be particular to your particular states. So some that I'll mention here. The state legislature in places like California and Massachusetts, you might have seen in the news that they are issuing legislation to move forward to get relief to otherwise ineligible immigrants who are living in their state borders and trying to get relief because they're not working either. But they're going about it in different ways. In California, as I understand it, they are pursuing money that would be distributed to local nonprofits, who then in turn would get it to immigrants in the areas. Massachusetts is looking to use the ITIN number I mentioned before as the vehicle to provide assistance to immigrants. So look for legislation in your particular states. If they do pass, that is another potential resource for relief for the immigrants you're serving. Disaster relief programs are another way that immigrants could potentially receive relief. In particular, the Pandemic Electronic Benefit Transfer EBT programs. Between disaster and the pandemic EBT programs, we all recognize schools are not in session and people might be eligible for reduced price meals for food. These types of programs step in the event of a disaster and people can still receive assistance. So some benefits there. Finally, coming from Catholic Charities, private and community centers such as food pantries, things of that sort, are available, and people are welcome to use private assistance in that manner. But as you can imagine, this as the resource is being crushed across the country. People are going a lot more than they were in the past. And so understanding what benefits programs are available through the state and federal government, if you're a service provider, is crucial. because it does help spread around more assistance to more people. Next slide. Okay.
I think that's it, Chris.
Yep. So I'll kick it to Ashley. I'm happy to answer any questions at the end. But do contact local Catholic charities in particular, just to talk to service providers and immigration attorneys as well.
Hey, Christopher, great information as well. I wrote down for myself how the funds that folks are getting are being described as rebate checks, so that's helpful for me. There's a question here about folks. How do they check on when they might be receiving some of these government funds, either through a direct deposit or with a paper check? Do you have information about that? And if not, maybe we can get back to this person later.
Yeah, I don't. The immediate resource I would be is to check the IRS.gov website and their COVID section to kind of see if there's any delays, potentially checking addresses, things like that. But I don't know individual cases. I just know a lot just from news reports that they were issued last week through direct deposit, and then later in the week and going into this week, they should have received paper checks if they were eligible. So if not, check the IRS page at this point.
Great. Thank you, Christopher. We might have some more questions towards the end. Appreciate it.
Sure.
I'm going to go ahead and turn it over to Ashley Feasley. I'm sorry, was someone trying to say something? Okay, Ashley, I'm going to go ahead and turn it over to you for your portion. Ashley, go ahead. Ashley, you may need to press *1 to unmute yourself.
Hello?
Ashley? Yeah, go ahead, Ashley.
Yeah.
We can hear you.
Hi. Very quickly, I know people have a lot of questions. So you've heard some great information, and I'm just going to talk a little bit about a couple things as it relates to messaging and kind of next steps. So as Tony mentioned, and we've sent out many emails, we have a COVID-19 migration-related resource page. You can find all sorts of great resources there, including resources from many of the presenters on today's call. And so I urge you to go in and look at it often. We try to update it every week. We will have other things to put on it for next week as well. So just a little quick plug for that. And now we're going to talk a little bit about kind of our next asks. Laura talked about the many packages. And, what are we in the migration space, understanding what Clay and Chris have said about, just exactly how immigrants and refugees, frankly, have been left out of the packages. What are we going to do about it, and how are we going to ensure that refugees and immigrants are included more robustly, and also some of the issues that Chris and Clay have highlighted are kind of rectified. So on our COVID-19 migration-related page, we have a document that highlights these points. That's on the slide right now, which is our COVID-19 legislative package priorities for the fourth package. Laura, I think, did a really good job of laying out a lot of the different kind of politics and elements, and she, very, presciently said, we don't know exactly when it's coming. Right now, we know that Congress will be back on the 4th, so they say, and it will be kind of a go, go, go moment. As many of you know, working on many issues besides just immigrants and refugees, lots of people are hurting, and lots of people either were left out or really haven't either accessed that relief yet, or still need more given the extent of the pandemic. So I'm going to quickly go through the 6 asks, which are actually in the action alert that just went live yesterday. And these are asks that we are doing in partnership with the organizations who are on this call and the other JFI core group members. So number one is the providing no-cost COVID-19 testing and treatment for all, regardless of immigration status, as this is a public safety issue. Clay really, I think, hit the nail on the head. There is no access to care and testing for the undocumented in these packages. We did work very hard to try and get it into the House proposed vehicle, which did not end up becoming law. Needless to say, this is just such a vital issue. It's our number one ask, just to make sure that for everybody's safety, immigrants and refugees are included regardless of their status. They should have access to care. The next issue is one that kind of leads into, most notably DACA, but also deals with TPS and some of our other immigrant categories. And this is a request to automatically extend work authorization and, in certain instances, visa renewal deadlines for certain immigrants and refugees who are providing economic and recovery assistance to our country. Who are we talking about? Well, we're talking about our DACA applicants, our temporary protected status applicants, as well as certain, employment visa categories that are really vital to our recovery. These individuals, they're in our legal immigration system. They are being impacted by the USCIS office closures, and they are also helping on the front lines of COVID-19. So this is why we're asking for this at this time. It's really an important ask, obviously, for the health and health of the nation on its COVID-19 recovery. But as you know, working with immigrants and refugees, it's very important when we think of the looming Supreme Court case for the DACA decision, as well as some of the pieces that are in the federal courts and in the Supreme Court for the TPS, decisions as well. And so this is a very important ask, and it is something that we're seeing some interest by certain Republican offices on. The third is just to ensure that many hardworking, struggling immigrant and refugee populations are eligible for cash rebate payments. Chris did a great job of explaining how there are many gaps, and we are still working to figure out really who is going to be covered and who isn't. Can't stress enough how much that we want all families to be eligible for assistance because we know that they need it right now. The fourth is the idea that we would like to halt all the implementation of the new public charge rules. Clay did a great job of explaining just why, immigration service providers and healthcare service providers, as well as those who are focused on nutrition and access to food, are really concerned about this. Certainly, we would like to make sure that this, what we think is draconian public charge rule, is not implemented at this time. The last two are specific to populations that we're not hearing about because they're not coming at this time due to mostly regulations from the Trump administration. With the March 20th partial border closure order, unaccompanied children and asylum seekers were no longer able to access protection in the United States. We are very concerned about this, and you can learn more on the JFI webpage. We have a backgrounder about the President's partial border closure order, but we just want to make sure, since so many immigrants and refugees have been left out of this process, that we as Catholics continue our commitment to asylum seekers and unaccompanied children, and making sure that they are included, particularly as we are trying to make sure that any services that they're provided are healthy and safe and don't lead to further infection for them, their families, or their communities. The last is related to our refugee resettlement program. We are asking for additional funding, and the reason we're asking for additional funding, and I believe one of our speakers talked about this, a lot of the refugees who we are serving have also been hit by the economic downturn. Many of them, in the case of South Dakota, were providing labor for some of the meatpacking industries that have been so hard hit, and we are hopeful to have some more assistance so that we can help provide ancillary services through our match grant program. And so those are the asks. There's a lot of them, so we have our backgrounder on the page, and they're also listed in the action alert. I want to just close very quickly to the idea of messaging. And so this is just a couple messaging points. We here, obviously, at the USCCB, Migration and Refugee Services is not the lead office handling the COVID-19 response. That is the DSD office, Domestic Social Development, as this is originally a healthcare issue and does affect many other things. I think that's important to note because I think that we need to be thinking about our messaging if we want to get bipartisan support. And so my first point on this is that this is not about immigration. This is about public health. Many of our speakers have talked about that, but really I urge you when you're speaking to your lawmakers about this, if you're encouraging people to reach out on these asks, it really is an issue of public health and ensuring that everyone is protected and therefore is not going to harm themselves or others with possible, COVID-19, infections or complications. And the second point really piggybacks on that, and that's ensuring access to testing and care for all will make all safe. This disease knows no boundaries. It knows no limits. That being said, the U.S., along with many other countries in the world, are closing borders left, right, and sideways. There is a competing tension between feeling safe and feeling, prosperous, and also this idea of making sure that we are doing what we can to be safe. And we need to be careful in our messaging to explain that this is not an issue of us versus them. This is an issue of making sure that everybody who is part of the human family has access to care so that we all can be safer and we all can put this behind us. The last point I want to make before we open it up for questions is that immigrants and refugees are part of the solution, and they're working on the front lines to fight COVID-19. This is a particularly vital point. In this moment of othering, we really need to focus on the fact that immigrants and refugees, not only are they our community leaders, our neighbors in faith, and also, part of our past and our future, these are individuals who are, along with U.S. citizens, laying down their lives to ensure that people receive care in hospitals, that people are able to get food on their table, that vital things, continue to keep on going while we're in this moment. And so I include a couple quick statistics for you there that you can see. We have some other statistics, and we're happy to follow up with you on these. But, we know, for example, that 3.8 million immigrants, more than 1 in 5 workers in the U.S. sector are providing, the care for our food and food supply chain. So a huge factor, as is the fact that 27,000 DACA youth work as healthcare providers and are engaged at this time. So I'm going to take it back here. There's one more slide, and it's the text of the action alert. We really do urge you to look at the action alert, to disseminate it. We're happy to make it a text of a letter. Certain dioceses and state Catholic conferences have asked us to do that, and if you are interested in that, please send Tony or myself an email. We will happily help you do that. And so I'm going to turn it back to Tony.
Great. Thank you, Ashley. And Matt Davis in Camden, it looks like Ashley did answer your question. So this is the action alerts that you're looking for if you want to organize folks in your diocese to carry out some advocacy. So there are a few questions here. Let's see here. Just a moment, let me get to the questions. There's one from Christina about if refugees and asylees received their status in 2019, are they eligible for any of the assistance? Ashley or Chris?
This is Ashley, and I can take the first crack at this, and Chris may have things to add. So if a refugee is newly arrived in 2018 or 2019, one of the criteria to ensure that they get the rebate payment is that they have filed a tax return. And so that is something, there are other forms, but that is something that would be a factor, as is, the proof of their residence. So if they're newly arrived and they have not, they then go into needing kind of to see if they find themselves within some of the exemptions. This is a concern that we have. There are a number of vulnerable populations like the newly arrived refugees from 2018 and 2019, Cuban and Haitian entrants, and asylees, so asylum seekers who have successfully applied for and received asylum are eligible for certain, benefits, I would say carefully, because it's not really an extensive benefit. And we're worried that they are not going to be able to access those cash rebate payments as other individuals are, even though they are, legally here. And so this is one of the things that we are working to rectify. Chris may have more to add on that, though.
Yes, checking my notes on it, adding to Ashley's point, critical if, like a new arrival, getting a Social Security number, that's critical. So when you got that, and depending on when you got it, is the critical question. Tony, if you don't, let me circle back to my note so I can get a better answer on what I have, and then I'll answer it at the end.
Sure, Chris. And Chris, we've had a couple iterations of this same question or request. Can you just review for everyone the eligibility of folks who may not have a Social Security number, who may be in mixed status families? And I think I put up the slide for you right here.
So mixed status families not eligible. As I understand it, I think there was another question about, well, if one of the parents has a Social Security number but the other doesn't, in essence, a mixed status family. It's my understanding from what I've seen is that no one would qualify. The reason being, they're looking back at your taxes from previously filed years. So you can't say, well, I have my social, why don't I get my individual rebate? If you file jointly, that would prevent that. I haven't seen anything differentiating on that to say that people, are in a mixed status family and did in fact get a check. So that's how I've seen it being portrayed with reports and how it should work. So that's kind of where mixed status families are. They are not eligible for that.
Thank you for the clarification, Chris. Appreciate it very much. Let's see here. We have a few folks typing. Maybe we can take one or two more questions in the last minute and a half that we have here. But while we're waiting for folks to type, please, everyone, you can visit our Justice for Immigrants COVID-19 resource page. We have resources there that Ashley mentioned are updated frequently. We get some new information, and if there's information there that you're unable to find, you can send us an email, and that's our general JFI email box. But I've also typed in my own email address in the chat box. I'll do that again so that you can send questions to me directly. The recordings as well will also be on the recording of this webinar will also be on the JFI webinar page, and I'll send that to you all when I send out the copy of this. So here is my email address. I'm putting it in now. Any final questions from anybody? Okay, well, I'm going to go ahead and end this here. Much appreciation to my colleagues, Laura at Network, Clay at Catholic Health Association, and Christopher at Catholic Charities USA, as well as Ashley Feasley, my boss here at Migration and Refugee Services. Thank you for providing this information, very timely, very important, that folks are able to use and share with others in their communities and in their parishes. And folks on the webinar, thank you very much for spending an hour with us on this very important issue. Please take care of yourselves, do what you need to do to stay healthy. And with your prayers, I know that we'll all come through this very well. Thank you, everyone. Take care. Goodbye. Bye-bye.